So here at R3 Health, one of the biggest questions I get asked about is arthritis, especially because we do a lot of non-invasive orthopedics. So there are several different types of arthritis. We're going to focus this video on osteoarthritis, which most people more commonly know as age-related or wear and tear arthritis. But just for completeness, other forms of arthritis that are more systemic, that are not age-related per se, things like rheumatoid arthritis or psoriatic arthritis, these are things that are more systemic versus osteoarthritis, which we're going to talk about as more wear and tear. Osteoarthritis, very common. Unfortunately, over 30 million people in this country suffer with a form of osteoarthritis. And again, it's that age-related arthritis, which means because we live very active, busy lives, we start to have degeneration or wear and tear of our bones and joints. And so osteoarthritis is a condition where we start to develop loss of the soft tissues, right? So if we look at my buddy here and we focus more so on his hip joint, this ball and socket, right, this femur bone and this iliac crest or this pelvic bone, this area here, there's connective tissues, almost like a cushion, right? And so as we live our life, we lose that cushion because of the grinding of the bones. So we start to lose cartilage, meniscus, labrum, etc. And osteoarthritis is the development of bone spurs or protective bone because we've lost that buffer and that cushion. And unfortunately, osteoarthritis is something that can affect any joint, knee joint, hip joint, spine joint, elbow joint, etc. I also want to point out that this is not just an old person disease because there are people who will start to have those degenerative changes 30, 40, 50, etc. So you want to be as preventative as you can. And so one of the questions that we get is, well, what do we do about it? So we can start with some supplemental treatments, right? So there's a couple supplements that we use here in the clinic that really help to reduce inflammation. So the first one here is our Joint Plus supplement, which contains MSM, glucosamine, chondroitin, all of which help lubricate those tissues. The other option here is Curcu Plus, which is turmeric and curcumin, which really help with decreasing inflammation, helping hydrate the joints, keep everything lubed and glided and moving freely. Other things you can be thinking about, CBD products, which have a lot of anti-inflammatory effects as well. Next step up as far as treatment of osteoarthritis, we then start to think about peptides like BPC-157, clinical treatments like PRP, clinical treatments like stem cells. BPC-157 is a peptide, which is an amino acid that also really helps to strengthen and help with regrowing of those connective tissues, labrum, cartilage, meniscus, etc. So we can either do a direct injection into the affected joint, or patients can actually administer BPC into their bodies and allow those growth factors to then target specific areas. Something like PRP, on the other hand, platelet-rich plasma, is a more invasive regenerative therapy where we're actually taking the body's natural growth factors. So our body has thousands of different cytokines, chemokines, fibroblasts, stem cell signaling proteins, and what we do is we'll harvest someone's blood, we'll isolate the growth factors from it, or the fertilizer, if you will, from it, and then we'll directly inject that into an affected area. Same concept is true with stem cell, but with stem cell, instead of using fertilizer from the body or from a donor, we're basically using stem cells, which is the ultimate kind of regenerative capability because it's almost like implanting a seed. That stem cell recognizes that it's injected into a hip joint and it understands that there's cartilage that's worn down and that those stem cells have to, what we call, differentiate or turn into cartilage tissue because it's been destroyed in that area. This is just a very high-level overview. Again, thinking about osteoarthritis not just as an age-related thing, but something that we want to try to be as prophylactic or preventative as we can, so that way you can continue to live the most active lifestyle that you're looking for.